I'm David Costello, and I serve as the Chief Analytic Officer at Cotiviti. Interesting topic here today. Data integration, the emergence of answers to unsolvable problems. Why would I want to talk about unsolvable problems? There's no sense in having integrated data if you can't do actionable stuff with it. You need to generate insights that drive value back into your organization. That's really what integrated data does for you. You have a lot of claims coming in early. Why don't you generate your insights early? Here are three solutions that we have. We have our quality performance analytics, the DXG score, predicting how risky or how costly that member is going to be next year. In the middle, I have our risk adjustment. We help pull the claim, and then we run our analytics on identifying missing HCCs, hierarchical condition codes. The last thing I have up here is on payment accuracy. Ensure that health plans and providers are properly paid for the work rendered. I took three core metrics, one core metric out of each line of business, simplified them and just created three buckets, high, moderate, and low. My metric, percent payment claims edited. The average is I'm editing around, in this population, around 22.8% of all claims. What do I see in my population here? Who am I editing the most? My lowest risk patients. So you can start thinking to yourself, if I'm editing low risk patients, what is my return on that value going to be, even if I do edit it? Let's look at risk adjustment. I know if I'm going out after higher risk patients, I'm going to find something. And that's not just smart. It's going to drive value back into your organization. If you just cross-pollinate your metrics, you can identify value. That's the easy stuff. But we really want to say, how do we really make the orchestra sing? If you think about it, what do? We had three measures for quality and performance, three measures for risk adjustment, and three measures or segments for payment, correct? 3 times 3 times 3. Who's the mathematician here? 27 portals of insight if I just cross the 3. So we see here the three different solutions within your organization, right? We see the quality and performance, which is going to be represented by our risk score. We see our risk adjustment, which is going to be represented by our HCC metric. And we see our payment accuracy, which is going to be represented by our payment per edit. So let's just look at this and say, somebody that's high risk in my risk score, predicted risk score, somebody that's high risk in my projected HCC score, and somebody that's high risk in dollars per edit, that's a pretty interesting population. 800 members out of 247,000. Not too many, right? But the most important thing to look at is the very bottom number. What is that? What percent of payment savings is generated by those fewer than 1,000 members? 6% of all your savings are coming from that population. I'd be going back to my organization and said, how do we do this? How do we pinpoint those individuals? Because I don't care where they're falling, I need to pull them. I need to look at them. 1,000 members can provide you that much insight. Whether you use this approach or whether you use some other type of segmentation approach, what is critical here is we're taking information that you can do within your own organization and cross-pollinating these metrics. Because what did I talk about before? It's not that those metrics don't provide value within that particular silo. It's can they provide additional insights as I look across silos. It's the idea, not the metrics, that matter. It's about the idea of working across your organization and your organizational silos to produce value. Your next step is to help you and your organization to fully realize the value that are locked within your data silos and use the power of these integrated metrics to unlock that value.